Sometimes we'll ask you to strip a drain because sometimes it just blocks up a little bit with a clot. And we actually have a patient here who's a nurse and knows how to strip. So show us how you do it.
I'm just going to hold the base of the drain so you don't pull on your armpit.
Move your hand away just so they can see that you're pinching with your
I'm
left hand.
pinching my left hand.
Okay.
And then I'm grabbing the alcohol pad with my right. And all I'm going to do is slide the alcohol pad down. And it slides very easily because it's saturated with alcohol. And you're just going to pull and tug on the drain all the way down to the bulb. And what this does is helps with the fluid moving into the bulb and clears the drain of any clots.
Now, this drain isn't clogged, so you're not going to see a big flow, but sometimes you'll do this and it'll release something and you'll suddenly see it drain. Can you just strip it one more time so people can see exactly the motion? So describe what you're doing. You're pinching.
So pinching the top as far as I can get at the top of the tube, and then I'm putting the alcohol pad around the tube and gradually pulling down on the tube while stretching the tube to help move the fluid through.
And that creates extra suction, and if there are little clots or something, it'll help move it down to the bulb.